In this video, we are going to be completing sick call encounters. So whether e-visit is being used at your facility or you are still on paper, the medical records clerk, once the slips have been triaged, is going to create a sick call triage appointment for the following day. So the first thing you need to do as the nurse completing sick call triage is to locate the patient's name, who you will be seeing, mark the box next to their name, click on update appointment to check our patient in. You're going to click on the name of the patient to enter the progress note. Once in the progress note, we're going to navigate to the sick call triage smart form. So up at the top where it says SF, you're going to click on that and then scroll until you reach the sick call triage smart form. To document the smart form, you're going to answer the first question: has a patient received a face-to-face triage encounter? This should always be yes. If for any reason this is no, that should be taken to your supervisor immediately. You're going to select the appropriate appointment or follow-up that the patient needs. If you select no further follow-up needed, then this will be the end of the visit and the CRE will not schedule a appointment for either option. For this example, we're going to click on sick call appointment. You can have the patient seen emergently, urgently, or routine. For our patient, we're going to select routine. The time that should elapse between the form being completed and and when the patient should be seen is next to your option. So we're going to select routine, and then you always want to type in what the issue was for the patient. And what the issue is what their complaint was on the sick call slip. Once you've documented the complaint, you're going to hit save. It's going to tell you that your data was saved successfully. You're going to close this, and then we are going to lock the sick call triage encounter. We always run the clinical rules engine, and in this case, this would be imperative. We need to make sure that patient is seen for their follow-up visit. You'll see that the sick call appointment was scheduled. And we are going to lock our encounter. Per usual, you're going to return to the clinical visit console and check out the appointment. On the day of the patient's RN sick call appointment, the nurse is going to locate the patient and check them in. Once the patient is checked in, we're going to click on the name to enter the progress note. Vital signs are obtained for the patient. You'll click on where it says vitals under objective. And the row that is highlighted in yellow is where you'll document your patient's vital signs. You can double click into the space, use your keyboard, enter the values, and hit tab to proceed. When you are done documenting the vital signs for the patient, you want to make sure you check off the box that says vitals taken and close the window. In the event that you have to order medications for the patient, what you want to do is go into allergies and intolerances. Verify the patient's allergies from here and close the window. You're then going to select the appropriate smart form that applies to the patient's issues. It would be a NET form. You would document the note and be sure to document all of the mandatory options. When you are done documenting, you want to select Save. Be sure that you complete any other documentation necessary for this encounter. And if you need to order medications for the patient from this encounter, you would refer to the workflow, the pharmacy workflow 9A or 9B for ordering medications. When you are done your documentation, be sure to lock your note. Run the CRE. Remember to click OK in the CRE window. And as always, return to the clinical visit console to check your encounter out.